musculoskeletal system. Basically, I am going to teach you about bones, how there are 206 bones in our body. So, we have total number of 206 bones in a human body. So, dear friends, dear learners, we will study about the human skeleton in this video. Human skeleton. So, if I divide the human skeleton, we have two types, or you can say two different parts of human skeleton. One is your axial, and then second is your appendicular. In your axial you have total 80 bones, and in your appendicular you have total 126 bone. Now how can you divide this axial and appendicular section? What is axial and what is appendicular? So in this section, whatever is your extremities and all, if this is your human body, so your hands, that means your upper extremities, your legs, that means your lower extremities, plus girdles from this section and from this section, these all things comes under appendicular. And the rest of the things, that means your head and your spine, this comes under your axial section. Then we will study about the axial and appendicular differently. Okay, so first we will study about your axial portion. In axial portion, you mainly have your skull. This is your central portion is involved in your axial portion. Whatever comes in this center, that it comes with your skull, then it comes with your hyoid bone. This hyoid bone is a horse shoe shaped bone. Then we have your vertebral column. Then you have your vertebral column. In this you have formula CTLSC. That means you have total 6 cervical, 12 thoracic, 5 lumbar, and then this one bone, and then this one bone. Then sacral is one, and then coccyx is one. Now the questions come from here is your sacral bone is fused of 5 bones. Then in coccyx you have mainly fused your 4 bones. Then after that you have your auditory ossicles. Auditory ossicles means your ear bones, whatever comes in your ear bones. So you have total how many bones? 3 in each ear, that means total 6 bones. Then you have your rib cage. Then in rib cage, what comes in rib cage? There are basically 2 things in rib cage. One is your sternum, and then your ribs. Sternum is only 1, and ribs you have 12 pairs. That means total you have 24 bones. Then in rib cage you have total 25 bones. In ear ossicles you have total 6. In vertebral column, if you count all these things, you will have 26 bones. Hyoid is only 1 bone, and then we will study about the skulls. In skull you have total 22 bones. Now how these 22 bones are divided again? In these 22 bones you have cranial, and then you have facial bones. In the cranial one you have total 8 bones. How many? 8. How come these 8 bones? Then you have your frontal, that is 1, parietal, that is 2, temporal, that is 2 again, occipital, that is 1, ethmoid, that is 1, sphenoid, that is 1. Here there is one questions used to come again. The sphenoid bone is also known as your bat shape. Bat shape bone. Then we will talk about this facial, that these are total 14 bones and we will study them here. How are these facial bones comes up? One is your zygomatic. These are total 2 on each side of your face. Maxilla, your 2 bones. Then your vomer, 1 mandible, that is 1. The question comes here, only movable bone of skull. The rest bones of skulls are non-movable. Only mandible, that you can chew, you can speak through this bone. This is your mandible bone. Then you have nasal, again 2, lacrimal, 2, palatine, 2, inferior nasal, concave, 2. So here comes your 14 facial bone. 2 plus 2 plus 1 plus 1, 2, 2, 2, 2, 2. That means 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Total your 14 bones. Here your 8. 1, 2, 3, 4, 5, 6, 7, 8. Your 8 bones. That is your cranial. Then 14. Then the hyoid bone, horseshoe shaped bone. This is the only bone not connected to any of the bone. The question can come up like this. Then your vertebral column, 26 bone, C6, T12, L5, S1, C1. Total 26. Then you have auditory ossicle 6, rib cage 25. Now if you will count the axial portion, 22 plus 1 plus 26 plus 6 plus 25. These all will come up as 80. So here comes your axial portion. I hope this is clear to you all people. Now we will study about the appendicular. These are total 126 bones. We will study how these will come up as 126 bones. So I have told you earlier that your the portion, your hands and your girdle, that means this portion, this portion, this portion, this portion plus girdles comes up in this section. Now we will study each accordingly. First comes up with your shoulder girdle. Shoulder girdle. So you have total 4 bones here. This shoulder girdle is also known as pectoral girdle, or you can say. Okay. Now how come these 4 bones totally? You have your clavicle and your scapula. So you have total 2 clavicle and 2 scapula. That means you people have 2 shoulders, right? You people have 2 collarbones, right? So total you have 4 bones. Now this second part comes up with your upper extremities. Upper extremities. So usually you people have two hands, mainly two hands, right? So in one hand you have 30, in other hand you have 30, so total you have 60 bones in your upper extremities. Now how come up this 60? We will divide this 60 here in one hand, in one hand. Then you can multiply into 2 because you have how many hands? 2 hands. So if I'll talk about the upper extremities, you have the upper extremities like this. Then here you have one joint, and then you have your 5 fingers. 1 2 3 4 5 fingers. So this one is your humerus, your longest bone. You come up they'll come up with the question like this. So humerus, that is 1. Then you have your here 2 bones. One is radius, one is ulna. So radius 1, ulna 1. Okay. So how can you tell which one is your radius, which one is your ulna? So if you will think this is your hand, if this is your hand, then usually which kind of pulse you take here? Here you used to take the radial pulse. So towards the thumb you have your radial bone, and away from the thumbs, that is on your pinky finger, that is on your pinky, you have your ulna. That is, you can remember with the thing, pinky is on ulna, yeah, ulna is on pinky. You can remember this kind of rhyme. Okay, your pinky finger. Then with the other trick is that you used to take the radial pulse here. So on you used to place your hand here. So with your thumb you have your radius. So next, moving on to the next things, you have your this area. In this area you have your wrist. In your wrist and your palm. Wrist means this portion. This portion is your wrist. Then this portion is your palm, and these are your fingers. So wrist, palm, and your fingers. So in medical language, what terminologies we will use for the bones of wrist bones, we will call them carpals. In palm, you will call them metacarpals. Then you will call them in your fingers, you will the fingers, or you can say digits, you will call them phalanges. So total you have 8 carpals, you have 5 metacarpals, then you have 14 phalanges. Okay, so if you will count all these things, these will come up as 30, and as you have another hand, you will multiply them with 2, then you will have total 60. Then come up with next, that is our girdle from the lower portion. The girdle from the lower portion is known as your pelvic girdle. In your pelvic girdle you have total 2 bones. Okay, you have total your 2 bones, because as you can say in shoulder girdle you have 2 clavicle, 2 scapula, but if you will say you have one pelvis kind of thing, this butterfly kind of shape of thing is your pelvis. In this pelvic girdle you have only 2 bones. These 2 innominate bones are fused with 3 bones. I'm just telling you in detail that these 2 bones are fused one. If you will say your pelvis is made up of total 2 innominate bone plus 1 coccyx, and 1 is your plus 1 coccyx, that is your coxal bone, that you have learnt in this coccyx, you have learnt in your axial skeleton. Already you have covered it, so you will not count it here. So these they are total 2 innominate bones. This one innominate bone is fused with 3 bones, that is ilium, ischium and pubis. Along with 3 you will call them one innominate bone, because they fuse and make one innominate bone. So your pelvic girdle has 2 innominate bones. So next we will study with our the next thing, that is your D part, that is your lower extremities. In lower extremities again you have 30 plus 30 is equals to 60. That means 30 in one and 30 in another leg. Total you have 60 bones again. Now how? If this is your leg, then you have your patella. This is your one bone. Okay. Then you have your again 2 bone. Then you have your ankle. You have your foot, and you have your phalanges. Right. Then this is your femur. Femur is the longest bone. Total you have 1, and in your whole body you have 2 femurs. Then if you move on, you have patella, that is 1. Then if you move, then you have your 2 bone, that is your tibia and fibula. That is inner one is your tibia. Tibia is inner. T in fibula is outer, that is your outer. If you will stand and whatever bone is outside, that means towards your thumb will be inner one, so tibia is towards your toe and fibula is away from the toe. Then total you have 1 plus 1. Again the tarsals. I told you, if you assume this as your foot, then this is your ankle, this is your whole foot, and these are your small toes if you'll count them. So your ankle will be called as tarsal, then your foot will be called as this palm section in your foot will be called as, or you can say sole will be called as your metatarsal, and you have again your digits or your toes, these will be called as phalanges again. So how many? 7. You have read earlier that there are 8 carpals here in wrist, and that is the only golden point you need to remember over here, is you have 7 tarsal, but still you have 30 counts. You have count 30 again. How? That one missing from here is your patella, that is your knee bone. That is how your count is completed again, that 30 bones in your hand and 30 in your legs. Then metatarsal 5 and phalanges again 14. So these all will come up as 30 multiplied by 2, because you have 2 legs, then total comes up with 60. Now 126. How? 4, that is your shoulder girdle. 4. Okay, upper extremities, you have 2 hands, 30 in each, total you have 60. Then you have plus 60. Then pelvic girdle, you have 22 bones fused, then you will have plus 2, then plus you have 30 plus 30 is equals to 60 in your legs, then total 126 bones in your appendicular. So 80 from axial, 126 from your appendicular. So if you add them, you will get 206 bones. Thank you. I hope you learned the bones as well, and also the special question you can come up with the bones and the special things that you can have from these things as per the nursing point of view. I'm telling you again, I'm teaching you all according to the nursing point of view. I'm not telling you to go in detail regarding all these topics, because definitely you'll come up with this topics only. Okay, thank you.